Let me ask you this. With Kinsula and Leqembi now approved, what kind of clinical results are we seeing with those drugs?
Well, it's early yet, but I think we're seeing a biological response with the drugs, meaning that the drugs are doing what they're supposed to be doing by lowering the amount of amyloid in the brain. What we're less certain of is what's the clinical response, because these drugs, again, are just meant to slow down the progression of the disease. They don't stop it, they don't make people better, but they do slow it down. But that's sometimes difficult to perceive. We're hoping that people stay relatively stable over this early treatment period.
Ron, how much more time potentially can this buy patients? Or is it, I got to believe it's on a patient by patient basis, depending upon where the disease is in their brain. But are we talking months or possibly years that this could buy families?
Well, we are talking about slowing the disease progression by, say, 30% over an 18-month period. What that translates to patients is we try to keep them stable, perhaps for another 5, 6, 7 months at their current level of functioning. Maybe as the drug goes out longer, say to 36 months, we might be buying 9, 10, 11 months of stability. At least that's the way we portray it to patients at this time.
What kind of drugs are you seeing that might be on the horizon?
I think the new things on the horizon are some of the drugs that are out there now may be changing their formulation, meaning that now they're intravenous infusions into the vein. But we're hoping that we can translate this to what we call a subcutaneous formulation. So you just prick under your skin and give the drug yourself. That would be great in terms of convenience for the patients. But further down the road, we're talking about better drugs and we're talking about combination therapy. So right now we're talking about drugs that lower the amyloid levels in the brain. But Alzheimer's disease is an amyloid and tau disease, a plaque and tangle disease. So we're talking now about some new clinical trials that will combine an amyloid lowering drug with a tau therapy to get at both aspects of the disease.
Oh my goodness, and that could offer even more promise to patients with early onset, correct?
We hope so. We think that by treating both of the biologic elements of the disease, we'll be able to be more forceful in actually slowing down or stopping the disease. Actually, the next horizon, though, is to take these drugs that we're using now for symptomatic therapy, meaning people with mild cognitive impairment, people with mild dementia, and move them back to what we call the preclinical space. So we're talking about people who would be clinically normal but have amyloid in the brain. So by treating them at that stage, can we delay the onset of symptoms and hopefully prevent the progression of the disease? That's up in the air right now, but that's the therapies that are, it's up in the air right now, but those are the clinical trials that are going to read out in the next 2 to 3 years.
Well, Ron, what you just described seems to me would put the emphasis even more on early detection.
Absolutely. I mean, early detection now for the earliest symptomatic features, but ultimately, even pre symptomatic for people who are biologically predisposed by having amyloid in their brain, but they're clinically normal at this point in time. That's exactly where we're going.
Ron, at what point should people get screened now for Alzheimer's?
Well, right now, I think if people have very mild symptoms, I think we need to screen people who are symptomatic. So people who are aware that their memory's not quite what it used to be, maybe not quite what it ought to be, and those around you, so your family members are noticing that you're not remembering quite as well as you formerly did. Doesn't mean you have Alzheimer's disease, but may deserve a look by your primary care physician.
Doctor, how far away are we now from, let's say, a blood test to determine whether you may or may not have Alzheimer's?
Blood tests are on the horizons. We're certainly doing them. Many centers are doing them. We're not using them right now to qualify for these new therapies, but we're watching it very, very closely, such that I think in another year or two, we will be pretty certain that these blood tests are accurate.
Oh my goodness, that fast.
I think so. Yeah. Yeah. I
Wow.
mean, there's studies. I mean, right now, the FDA in its language says to get these drugs, you have to have evidence of amyloid in the brain. You can do that with a PET scan. You can do that with a lumbar puncture or possibly a blood test. So they have opened up the door for that.
Wow, and that's coming. That's
Yep.
encouraging news.
Yeah, exactly.
Really encouraging. Doctor, thank you for your time. I appreciate it.
My pleasure. Look